Hi, my name is Dr. Mia Kirkarudo and I am a chiropractor. I am pursuing my advanced degree in chiropractic neurology as well as nutritional metabolic blood typing. I have been working in the Bay Area for over the last 10 years, successfully treating people with fibromyalgia. I work with a consortium of doctors who also have been treating successfully fibromyalgia patients for the last 20 years. What makes all of us different than any other doctor that you potentially have seen for your said condition? We treat patients metabolically and neurologically. You're watching this video because someone you know or yourself is suffering with fibromyalgia. I know what it's like to go through that process of going into the doctor, telling them that you have this problem, and them saying to you, hey, all right, well, let's try this. This pill has been proven to help with fibromyalgia in X amount of people. You take that pill, you take that drug, and nothing happens, or it increases the pain. And then you go back to that doctor and they say, well, okay, well, let's try another one. Let's try Lyrica. I'm sure all of you who have fibromyalgia have heard of Lyrica. Lyrica actually is not even a fibromyalgia medication. Lyrica is made for people who have epilepsy. It's an anti-seizure medication. Seizures and fibromyalgia happen, it's different brain chemistry that's going on. So this is why Lyrica does not necessarily work. All functions in your body can be affected with chronic health conditions. In my office, what we do to treat fibromyalgia is we test metabolically and we will treat neurologically. When we do these tests, we assess, in doing these blood tests and DNA swabs, so on and so forth, we're testing your thyroid, we're testing your adrenal glands, we're testing your liver, your kidney, your red and white blood cells, and your gut function. There is no stone left unturned to determine the exact cause of your condition. I treat this problem via the metabolic testing and the neurologic testing. Metabolic treatments based on specific lab panels, i.e., first panel we're going to do is a thyroid panel. Your thyroid is basically, it secretes a hormone called TSH. TSH, thyroid stimulating hormone, regulates your metabolism. Almost every single fibromyalgia patient that comes through my office has some form of thyroid problem. We do a complete metabolic panel. We do a lipid panel, we do a CBC, complete blood chemistry, and autodifferential. This is where we're testing the red and white blood cells. We check for gut function by doing sensitivity testing. This is our test to determine if what you're sensitive to, what you're eating that you're sensitive to. The major things that we have found is gluten. Gluten consists of wheat, rye, oats, and barley, milk, eggs, yeast, and soy. If you're sensitive to any or all of these foods, you have to stop eating it. It's causing inflammation in your system. It's making you get worse. It has to be eliminated. Some of the symptoms actually of these sensitivities can be chronic pain or fatigue. Hello, chronic pain and fatigue are the guideposts for fibromyalgia. Frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, sometimes even vomiting. With these tests, the whole point of these blood tests are that over the last, I'll just say 20 years, as our society has gotten sicker, the ranges of what is optimal health and function has gone from here to here. So you may come in and say, I've had all of these blood tests and my doctor says I'm fine and that's not the issue. That's not true. That is absolutely the issue because you're falling in the broader range where it says that you're healthy and you are showing up to my office with symptoms of fibromyalgia. This means that you are not in the optimum healthy state. We need to find out. We need to do the testing. We need to find out where you fall in that range. As I said, we have to do sensitivity testing. If you are allergic to any or all of those wheat, rye, barley, milk, eggs, soy, yeast, it's making your condition worse. What we have found is that most, not all, but most fibromyalgia patients are suffering from some form of autoimmune problem. That means that their immune system is attacking their nervous system and their brain. And this is why you're having this chronic pain. One day you have pain in your neck, one day you have pain in your back, one day you have pain in your knee. This is also what's causing the chronic fatigue, is this potential autoimmune problem, that there's not the proper firing. But we'll get into that in the neurologic problem, when the neurologic still. So we come back down to the next test in which we're going to want to do, which is an adrenal stress index, an ASI. This is, most fibromyalgia patients not only have some form of problem with their thyroid, they also do have problems with their adrenal glands. The adrenal glands are located on the kidneys, and they actually regulate the cortisol levels. So when there's too much stress in our systems, we have too much cortisol. And when we have too much cortisol, that causes insomnia. Most people who have fibromyalgia have some form of problem sleeping in the evening, and or they have some form of blood sugar level problems. The ASI test, it's a very simple test. It's a salivary test, much like DNA testing. Your adrenal glands, as I said, are the stress organs, meaning that they react to stress. If you have, or you are currently under stress, then this is an absolute must. We have to take this test. Caffeine in excessive amounts and sugars adversely affect the adrenal glands, just so you know. And I have a lot of patients who say, what? But regardless, if this is affecting your cortisol levels and it's affecting your sleep, it's affecting you metabolically, it's affecting you neurologically, we have to start eliminating these these foods and these things that are causing the difficulties and who are influencing your symptoms of fibromyalgia. The next thing that we need to do is an immune panel. Now, we have to decide where the issue is. We need to do these blood tests. We need to find out what is the problem? Is it an autoimmune? And there are two parts to the autoimmune. You have a Th1 and a Th2. Th1 is affected by, we're looking for markers. You're looking for interleukin 2 and you're looking for TNF alpha. Th1 mediates the T cells. T cells are like the armies in our bodies. They go out and they attack and they clean up all of the stuff that's there that shouldn't be there, all of the microbe, dead bodies, so on and so forth. These T cells are helper cells, suppressor cells, natural killer cells, regulatory cells, and macrophages. The other portion that we're looking for are Th2, and this is we're looking for interleukin 4 and interleukin 10. These Th2 B cells are actually, these cells make the antibodies. They direct the T cells where they're supposed to go and what they're supposed to kill. So we need to find out between these two which one is most dominant. We have to find out through these blood tests which portion of the autoimmune system is being affected. Do we have an active antigen or do we have some form of dysregulation? Active antigens, basically, we're looking at some form of foreign invader, a parasite, a bacteria, mold, fungi, yeast, protozoa, foods, chemical, heavy metals. Back to foods really quickly. This is why we're doing the sensitivity testing. We want to make sure that you are not allergic to something that actually is causing the autoimmune problem. This is basically the ratio is that once this test comes in, if it's 2.5 or higher, then we know that the dominance is an active antigen. And the best indicator for active antigen as the cause for abnormal dominance is your helper suppressor T cell ratio. This is called the CD4-CD8 ratio, but regardless, this is what we would do to figure out which situation, which it is, if it's active antigen or if it's a dysregulation. Now, if it's Th2 dominant where you have dysregulation, you're looking at some form of organ in your body that is not functioning properly. We're looking at issues potentially with the adrenal glands, the GI tract, blood sugar regulation, anemia. The markers for this is if it's 1.2 or lower, then that means it's dysregulation. The immune panel gives me an in-depth picture to what exactly is happening in your immune system. And if you're suffering from an autoimmune disorder, I want you to know right now it absolutely trumps anything else, and we have to deal with that immediately. That is the situation that we have to deal with. Needless to say, this is why we need to run the immune panel. We have to identify what is going on in your system. Another active antigen that we test for is H. pylori. We need to test to see if this bacteria is part of the problem or not. Is it infringing upon the gut function? One of the major tests that we do, which is really important, is the gut permeability test. This basically is a way for us to identify if you have leaky gut syndrome, LGS. This is a condition that basically alters or damages the bowel lining. And it's caused by antibiotics, it's caused by toxins, poor diet, parasites, infections. A lot of fibromyalgia patients come in with bowel problems, that they're experiencing loose bowels and then constipation and diarrhea and constipation and diarrhea, and it's this horrible cycle. And we have to identify if this cycle is caused by the LGS, if it's caused by leaky gut syndrome or not. If you have an increased permeability in your gut, things are going to leak out, and this is going to cause inflammation in the system, which is going to just continue this horrible cycle. We're going to test for neurotransmitters. We need to test to see if everything in your brain is working properly, or if the decreased neurotransmitters is causing the pain or not. We may or may not do a hormone panel. Again, it depends on what your autoimmune panel comes back telling us. But if you are showing up with signs of hormone problem, which are depression, fatigue, mental fogginess, which is also very indicative of fibromyalgia, hot flashes, mood swings, weight gain, sweating attacks, decreased physical stamina, then we'll identify and deal with the hormone problem. As I said, what's going on in your system is that you have a tremendous amount of inflammation. We're going to have to test for that. The inflammation in your system is what is causing this problem going on. We have to identify where that problem originates from. Just about every fibromyalgia patient that comes into my office that I have treated suffers from some form of chronic inflammation. We have to find the exact cause. We have to do the tests. We have to do them. Metabolic treatments based on lab tests. We use, just so you know, we use highly specialized nutritional protocols based on your very specific lab tests. There's no cause or cure for fibromyalgia, so it's kind of different for each patient, but we identify what specifically works for you and your specific situation, and we treat it. We help to get rid of those symptoms. Bottom line, end of sentence. We find the exact cause via the tests, and we treat it. One of, and this is very important, one of the major treatments that we use in the office is glutathione. Glutathione is the mother of antioxidants. Glutathione basically in our system helps to prevent these disease processes from happening. Glutathione decreases in your system as we age because of a decrease in oxygen, which I will get into more thoroughly in the neurologic part of this. I'm still dealing at this present moment with the metabolic process. So glutathione, we use glutathione in our treatment for all chronic conditions. As I said, it is the mother lode of all antioxidants. It is You can find glutathione and take it orally, but the problem with taking it orally is, if you have some form of problem with your gut, then it's not going to do what it needs to do. It's not going to permeate the tissue enough to bring the saturation levels up so the glutathione can work properly in your body. We actually do it a different way. We do it through a nebulizer where you're actually inhaling it, which will help to bring the glutathione levels up in your system faster. And we have had great success with patients, treating them with glutathione as well as the oxygen therapy. So oxygen therapy. Oxygen therapy we use in my office. Oxygen is fuel for your brain and your nervous system. Your brain and your nervous system needs two things to survive: fuel and activation. The fuel comes in the form of oxygen and glucose, and we covered the glucose in the metabolic section. By using oxygen, we help you to actually heal faster. So let me give a little bit of an explanation of how this kind of works with fibromyalgia patients. A lot of fibromyalgia patients will complain of a mental fogginess, like they're not able to express what it is that they want to say, that things are on the tip of their tongue and it's not coming out properly. This actually is located, this process is located in the front part of the left side of the frontal lobe, and that's called Broca's area. This is how we communicate with one another. I am able to speak to you via this DVD because my Broca's area is firing properly. The way that this works is that Broca's area fires into the brain. The cerebellum fires into Broca's area and into the brain, and then the brain fires back down to the top, middle, and lower brain, the pons and the medulla. This is a loop that goes around and around and around. You also have Wernicke's area in there, which is our ability to comprehend what's being said. So this is a loop that goes around with People who have fibromyalgia, this loop is all verkaukt. It's not working properly. And what's happening is the brain is firing, but it's bypassing the pons and the medulla, the lower midbrain, and it's going straight to the top portion of the lower brain, and it's driving that impulse down through the spinal cord, which is causing the chronic pain and the chronic fatigue. This is what's happening. So we need to basically deal with that, and that is dealt with via oxygen therapy and glutathione therapy. We use in my office oxygen therapy with cranial therapy, and we're able to increase the firing in Broca's area, in the brain, and especially in the left portion of your head, right over here in the frontal portion, which is going to help to increase that whole area. Now, a lot of fibromyalgia patients will have gone to see a chiropractor, for instance, and they'll get adjusted, and it increases their symptomatology. The reason for this is that most fibromyalgia patients are hyper-excitable. We call it reaching metabolic excitability, that they reach it too fast. And so when you've gone in and you've had, for instance, a neck adjustment, it's too much too soon. It's too much information into your body, so they actually make you worse. So with us doing the oxygen and the cranial therapy, you are getting the necessary firing into your brain in a very soft and gentle way. And this helps, as I said, to increase the firing in the brain. Now, once we have run all the necessary tests to determine your very specific condition, we can successfully treat you via the proper neurological and all nutritional protocols. So finally, I would like you to ask yourself these 4 questions. 1, how has your fibromyalgia affected your job, your relationship, your finances, your family, and other activities? 2, what has it cost you in time, money, happiness, and sleep? 3, where do you picture yourself in the next 1 to 3 years if your fibromyalgia has not been taken care of? And 4, finally, what is it worth to you if you can improve your fibromyalgia? So, my offer to you, I am offering to you today 2 free visits in my office. If you are interested, you can contact my office at 579-7074. I will be more than happy to send you out the necessary paperwork. You would come into the office, fill out the paperwork. I will go through the paperwork with you. That's the first visit. From the first visit to the second visit, I will review all of this paperwork based on what we have talked about, based on what you have said in the paperwork. And on the second visit, I will tell you if you indeed are a candidate for treatment in my office. I want you to know that I do not accept all cases. I will only accept those cases that I truly feel that I can help. I am only looking for patients who are serious about their health care and who will do whatever it takes to get better. I will stand with you if you too will stand for yourself. So, if you would like to schedule your 2 free visits with me, feel free and call 510-579-7074. Again, that's 510-579-7074. I am Dr. Mia Curcaruto, and I'm here to help you express your health.